NHA phlebotomy questions and answers. Let's get started. Which tube is used for lead level testing? Is it A, standard lavender top? Or B, royal blue top trace element tube? Could it be C, standard red top? Or lastly D, light green top PST? The correct answer is B. Here is why. Royal blue top tubes are specially manufactured and certified to have very low levels of trace elements, preventing contamination of the sample for accurate lead and toxic metal analysis. A. Standard lavender top tubes may contain trace amounts of lead in the stopper or EDTA. C. Standard red top tubes can also be contaminated. D. PST tubes contain heparin and gel, which are not suitable for trace metal testing. Next question. What does the R in the acronym RACE for fire safety stand for? Is it A, run? Or B, rescue? Could it be C, remove? Or lastly D, restrain? The correct answer is B. Here is why. RACE is a fire response protocol. Rescue, remove anyone in immediate danger. Alarm, activate the fire alarm system. Contain, close doors/windows, and extinguish/evacuate. A, C, D. These are common misrememberings of the acronym. Next question. Vigorous pumping of the fist before a draw can falsely elevate which analyte? Is it A, sodium? Or B, potassium? Could it be C, glucose? Or lastly D, calcium? The correct answer is B. Here is why. Fist clenching and pumping increases the local release of potassium from muscle cells into the interstitial fluid, which can be picked up by the venipuncture, causing pseudohyperkalemia. A. Sodium is not significantly affected. C. Glucose is not directly elevated. Lactic acid may increase. D. Ionized calcium is not released from muscle in significant amounts. Next question. When should a phlebotomist wash their hands? Is it A, before and after each patient contact? Or B, only after a procedure? Could it be C, only if hands look dirty? Or lastly D, at the beginning and end of the shift? The correct answer is A. Here is why. Hand hygiene, washing with soap/water, or using alcohol-based rub before and after every patient contact is the single most important practice to prevent healthcare-associated infections. B, C, D. These practices are insufficient and do not comply with standard infection control protocols. Next question. The single most effective way to prevent the spread of infection is it A, wearing gloves? Or B, proper hand hygiene? Could it be C, using needle safety devices? Or lastly D, wearing a lab coat? The correct answer is B. Here is why. According to the CDC, proper hand hygiene is the cornerstone of infection prevention in healthcare settings. A, C, D. While all are important components of standard precautions, they are secondary to the fundamental practice of hand hygiene. Next question. A patient has an 4 in the left arm. You should. Is it A, draw from the same arm below the foresight? Or B, draw from the opposite right arm? Could it be C, draw from the foreline if permitted? Or lastly D, use the left hand? The correct answer is B. Here is why. The opposite arm is the preferred site to avoid contamination of the specimen with 4 fluids, which can dramatically dilute the sample or introduce drugs/electrolytes. A. Drawing below in foresight is not recommended due to potential retrograde flow of 4 fluid. C. Drawing from in foreline requires a specific protocol, is prone to hemolysis and dilution, and is not the routine choice. D. Using hand veins on the same side as the 4 still risks contamination. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.